Tuberculinum. Proved by Dr. Burnett. Temperament, nervous miasm, sora diathesis. Tuberculinum is a no-soda-glycerine extract of a pure cultivation of tubercle bacilli, human, represents the heart of the tubercular miasm. The main feeling in this miasm is that of being shut in, the sensation of suffocation, especially when stuck in a place, and the need for hectic, intense activity. Therefore, miasm seems to demand a need for rapid change as a condition of survival. Clinical experience has shown that tubercular patients heal better in mountain forests with dry climate. History of tuberculosis, but have been treated by antibiotics. If they have been treated with streptomycin, there may occur a crippling vertigo. It is a vertigo which is not specific, with no modalities, feels as if the head is cramped. This symptomatology may respond to tuberculinum. Tuberculinum as a classic way of prescription may be done on basis of congenital state, his inherited illnesses. They are referred as consumptiveness, i.e. who have inherited phthisis are often of feeble vitality, takes on sickness easily, anemic, nervous and debilitated. A proving of tuberculinum was conducted in October 1993 at seminar in Speakerug. The provers received tuberculinum 200C. Many provers had dreams of intense and quick activity and used the word hectic to describe the dreams. Dreams having to do with trains going up and down mountains, which situations were described as being dangerous, risky and fast. Theme of risk and danger included descending into down on a rope with a feeling, so what if it is deep, of being in a narrow restaurant with a feeling that this was dangerous for her, of being bitten on the neck by a big dog, dreams of being oppressed by a neighbor. Other themes that came up were a need to help others, especially those in danger, and hopefulness. Preparation. Preparation was first prepared by Dr. Finke and Swan in 1879 from the sputum of a tuberculosis patient. A drop from the pulmonary tubercular abscess was taken. Bacillinum, originally called tuberculinum, was the earlier production, and, glancing through Burnett's epoch-making new cure of consumption, in the light of one's large experience in the use of, chiefly, tuberculinum bovinum, probably the infinitely more potent for good of the two. When Burnett was inspired by Koch, he was injecting it in potency, killed and sterile and triturated and, in the 30th potency, merely 1 part in alcoholic tincture to medicate a few tiniest pellets of milk sugar. Burnett says, if phthisis can be cured by bread and butter or attar of roses, well and good, but if not, then let us have something that will cure it. Dr. H. C. Allen says in his keynotes, the potencies of Fink and Swan were prepared from a drop of pus obtained from a pulmonary tubercular abscess, sputa. Those of Heath from a tuberculosis lung in which the bacillus tuberculosis had been found microscopically. Hence former was called tuberculinum and the latter bacillinum. Preparations are reliable and effective. Burnett tells us that the homeopaths, years earlier, using the virus of consumption to cure consumption itself, but the leaders of the dominant sect of the medical profession raised against those of the homeopaths to use the virus of consumption against the disease itself. The practice was almost discontinued, a few only publishing here and there a striking case of the cure of consumption by the virus of the process itself. Koch lies in the way it is obtained. Ours is the virus of the natural disease itself, while Koch's is the same virus obtained in an incubator from colonies of bacilli thriving beef jelly. Ours is the chick hatched under the hen, Koch's the chick hatched in an incubator. The artificial hatching is Koch's discovery, not the itself or its use as a cure for consumption, but there is one other difference, i.e. the mode of administering it to the patient. I use the remedy in high potency, which is not in dangers of Koch's method of injecting material quantities under the skin, or, in other words, straight into the blood. Constitution. Slender, tall with narrow chest or caved, thin or oval face, light complexion, blue eyes, eyelashes are long. Hair is soft and silky, lean, quick, muscular, sulfur, phosphorus, nux vomica, with rapid metabolisms and burn fat quickly. Emaciate quickly. Skin is fine textured, clear and translucent. Stylish dressing. Mind. Unpredictable in their moods and behavior. One minute they are refined and gentle, the next, malicious and destructive. People who burn the candle at both ends, they are full of contradictory feelings, mania and melancholia, insomnia and sopor, extremely sensitive to music and also fond of it, and likes dance and art. They are never truly satisfied with themselves, and also with other people. He doesn't know what he really wants, and no one else can find ways of satisfying him. Deep dissatisfaction, which leads to destructiveness, becomes irritable over and he flies to pieces. There is a desire to use foul language, curse and swear. Feels himself forced to use insulting languages, uses rough words. He feels his life is going to be short, so he hastens to make the most of it while he can. Tub patients are difficult people to live with. They seek self-gratification, but they never achieve it. Because of dissatisfaction, they continuously seek change. They go from job to job, or from location to location, always seeking escape from the dilemmas. Once they make a change, they may at first feel contented, but soon they again become dissatisfied and want to move on. These are people described in the books as being cosmopolitan. In their capriciousness, difficult to predict, and need for change, they are difficult to understand or to please. If they feel irritated, they usually want to be alone, and the best thing for them to do is to walk in the open air in the mountains, ameliorated by being in pine forests. Conversely, they do not feel well at the seashore. The situation of an orthodoxy or poor, middle-class person in an economically backward country is similar to that of tuberculinum. If he remains stuck or stagnant in that country, financial burden will oppress him. What he needs is rapid and hectic activity to get him out of such a situation. He feels sensation of suffocation and oppression of lungs from having to breathe within a restricted lung space. If he finds orthodoxy oppressive, he will break free from the bonds of society and undertake exploits which are rash, bold, daring and at times destructive. He cannot stick to the straight and narrow. He will not be confined by monotony. He needs to take risks and does so quite fearlessly, so can progress to destructiveness, both physically, cavitations in the lungs, or emotionally, burning out, at the end feels totally drained out of energy. Sexually, they are hyperactive, strong sexual desire. They go from one relationship to another, but always their love affairs are critical. There are many upheavals and conflicts. Fear of dogs and cats mainly as a disgust. They may even have allergies to the fur of cats or dogs. If they see a sharp knife, they imagine the noise it would make if plunged into someone, the crunching of bones and tissues. Independent and very often gives the impression that he needs nobody, emotionally or practically. Desire to travel and discover, out of excitement, fancifully and adventure because of great restlessness. If they cannot travel physically, he travels in his mind, reads magazines, pursues books, watches TV programs on traveling and often love to work in travel agencies or airline company for the opportunities it offers them to visit in new places. Restlessness which prompts them to aggressively enter into new experiences like sporting activities. They wanders in search of stimulation, and becomes bored when he is in one place doing the same thing for too long. He takes jobs that involve movement and work in the open place, for example like delivery boy, postman, landscape gardener etc., i.e. anything enabling him to avoid sitting at a desk. They can settle, providing their work and their partners are interesting enough. If he is running away, it is from boredom rather than fear. He is a relatively unemotional type, and is usually very clear-headed, and also confident. They feel there is something beyond. They live their life in a crescendo with a deep sense of unfulfillment. Lives for today, and loves for today, let the devil take the morrow. Physical generals. When the family history of tubercular affections, the best selected remedy fails to relieve or permanently improve, without reference to name of disease. Symptoms ever changing, ailments affecting one organ, then another, the lungs, brain, kidneys, liver, stomach, Nervous system, beginning suddenly, ceasing suddenly. Belladonna, Kali bichromicum, nitric acid, takes cold easily without knowing how or where. Seems to take cold every time he takes a breath of fresh air. Hepasulfuricum, aggravated by cold wet weather and ameliorated in warm dry climates. Emaciation rapid and pronounced. Losing flesh while eating well. Abrotanum, calcarea, conium, iodome, natrum, desire, pork, meserum, caloria phosphoricum, and pungent tasting meats like salami and smoked meats. Causticum, ice cream. Profuse perspiration all over the body, particularly at night, drenching the bedclothes, and may get up during the night to change their night clothes. Once the disease has taken hold, they progress rapidly toward destruction and death. The feeling of being stuck, suffocated and oppressed, as though some weight or pressure will increasingly oppress the patient, and the spot he is stuck in will grow narrower and narrower, and he will be suffocated unless he were to move out. The psychotic aspect is seen in the fibrosis. The person has to live for the rest of his life with a fixed, restricted lung space, and very often has tendencies to recurrent colds and respiratory affections. On the other hand, tuberculosis is also known to have violent, progressive, destructive features which are almost totally hopeless without medical intervention, e.g. TB, meningitis, miliary TB, etc. Poor concentration, teenagers who won't do homework, sleep, knee-chest position. Learning disabilities, lag behind in developmental milestones, slow to sit, walk or teeth or learn to talk. Children may be slow at comprehension and may find it exhausting to apply themselves to their studies, making homework. Restlessness, defiance and destructiveness, restless and hyperactive, even in their sleep. These children mess up the beds, fall out of them and grind their teeth. Bedwetting, head thumping and allergies. Heads may be thumped against pillows, bed frames, doors and walls, sometimes quite forcefully. Child is more susceptible to adverse reaction to vaccines and medications, making them more liable to develop autism and other more serious developmental disorders. Irritable, contrary, destructive to an extreme degree. They are born irritable and angry, crying and being very fussy, especially on waking. They bang their heads on floors and walls. They can also curse and swear. Anacardium, stramonium, hyoscamus. They can be destructive to themselves and others. They can hit and kick the teachers and parents. Violence may begin after an acute disorder or vaccination. Vaccination tends to push tubercular children more into the psychotic miasm. The tub child is intentionally malicious. Just when we are about to go somewhere, he will throw an uncontrollable tantrum just to spoil you. He may swear at his mother. They are capable of disrupting entire families. In infants, they are expressed on the physical side as a constant runny nose, the emotional side as the familiar temper tantrums. Develop slowly, late walking and talking, fear of new situations and fear of being observed, fear strangers, cats, dogs. Allergic reaction to, there is, stramonium, argentum nitricum, aconite, that may be expressed as a fear of being buried alive, zincum metallicum. On all levels they need freedom to express themselves and open spaces. Impulsive, they may display an abundance of ideas, can run away from things, and this may happen suddenly. Restlessness, particularly at night in bed, plays with many toys, bounces on the furniture. Hyperactive but tire more easily. Lactose intolerance, children who drink milk often lose weight with diarrhea. It is hard for them to gain weight. Anomalies as hydroceles, umbilical hernias and cleft. Gesture, alternating moods, excessive, stubborn, disobedient, exhibiting violent fits of temper that upsets the whole family. Kicking, howling and screams. If scolded, even though they are very small, they threaten back. Violent towards pets. Whining, Fretful children, who are fearful and timid especially of dogs. No child, stubborn and complaining, self-destructive, strike themselves especially on the head, or head thumping is very characteristic. Child is negative, critical and selfish. Breaks things, rushes around to relieve nervous tension. Unfulfilled yearnings. If he cannot afford to travel physically, he travel in his mind via book. Good behavior alternates with disruptiveness. Coldly and deliberately destructive and malicious. Flat narrow chest pigeon-breasted, tall slim, active, nervous and precocious but physically seek, phosphorus. Low recuperative power. Susceptible to weather changes, respiratory catarrhs, takes cold easily without knowing whom or where. ADHD, hyperactivity, concentration difficulty, and destructiveness. Child is hyperactive, restless and always seems to have too much energy. Such children can't slow down to learn anything and face difficulty while doing tasks that need concentration, destructiveness with a desire to break things, irritability, stubbornness, and fretfulness. They also are argumentative and tend to use foul language, want to fight, and have fits of violent temper tantrums. Compare Tarantula hispanica, inattentiveness and marked impatience, a restlessness of hands and legs, sudden impulsive, destructive behavior. The child may strike himself and others, tear the clothing, throw things away. Great excitement induced by listening to music, carcinosin, concentration and memory. Child remains in constant motion. He keeps on running, jumping, climbing here and there. The child is difficult to be seated in one place and is usually impatient, gets bored easily. Fears of the dark and being alone, have restless sleep. Hyoscyamus niger. Hyperactivity and excessive talking while studying. He may use inappropriate words and sentences or make up irrelevant answers. Unintelligible chattering. Emotional outbursts happens. Child may cry out suddenly or a loud laugh. He may insult, shout, scold, abuse and spit on people. He may make ridiculous gestures and is often seen to play with his fingers. Stramonium. Marked hyperactivity. He sits down, rises, kneels, rolls, creeps or takes other strange positions. He may also continually move his hands and arms. He is inattentive, cannot connect a sentence, is unable to give a proper answer, and cannot find the right words. He may tear his clothes, destroys things, and attempt to bite those who come near him. Veritrum album. Violent, impulsive and destructive behavior during violent outbreaks. The child strikes those around him, tears things up, has an impulse to bite. Excessive rapid, constant talking, at times with loud laughter, may also be present. The child may also have a habit of telling lies. Chamomilla. Ill-humored and irritable children. They are fretful, obstinate, cranky, cross, snappish, insulting, who cannot answer patiently. They cannot bear anyone near them and are averse to talking. They are very impatient and everything seems to go too slowly for them. Medorinum. He loses the thread of conversation, seems very anxious, and has severe mood swings. One moment the child is happy, the other moment he is sad. Mercury's solibus. Hyperactivity at night. The child is restless, continually moves from one place to another, has a hurried speech, and tends to be anxious and ill-humored. Gina. Irritable, fretful, and cross. They are always complaining about everything. They are not satisfied by anything, desire many things, which they refuse to accept when offered, and throw away everything given to them. They are very restless even during sleep and keep on tossing about in bed. Lachesis. Their curiosity is limited to materialistic things like jewelry, clothes and ornaments. Their clothes are the latest, upscale, fancy, colorful, and very stylish. Phosphorus. They may tear apart toys and machines to find out how they work with a straightforward curiosity like a podium. superficial curiosity, it is just to impress the other person. Sepia. Different types of music, dance and other physical activities which the experience of physical harmony. Physical healing arts like yoga, massage and shiatsu. Head. Vertigo, especially in morning, by bending down. With nausea. Intense pain, as of an iron band around head. Headache with sensation of heat, from neck to forehead, in morning, passing away in afternoon plicopolonica. Eyes. Breaking down of cicatrices of old corneal ulcers. Tuberculosis of eyelids, small gray and yellow nodules. Nose. Coryza, viscid, yellow-green. Comedones on nose, surrounded with minute pustules. The nose, which used to feel hot and burning, has lost this sensation. Teeth. Feeling as if the teeth were all jammed together and too many for his head. Inflammation of gums, scurvy-like. Mouth. Aphthy on tongue and buccal mucosa. On lips black blisters. Palate. Granulations enormously swollen and vascular, breath offensive. Tongue. Throat. Tickling in throat, exciting cough. Aching extending from throat to ears. Dysphagia increased, later diminished sensation of a tumor in throat. Nitric acid, appetite, loss of appetite, especially in morning. Thirst, extreme, day and night, burning in morning. Stomach. Eructations and sensation of fullness over stomach, vomited severely with greater than to headache and after every meal. Cramping pain in stomach in umbilical region with diarrhea. Abdomen. Colic with great thirst, fatigue and sickness in region of stomach and abdomen. Mass of enlarged glands, in right iliac fossa much smaller. Discrete papular rash over chest and abdomen. Perforating ulcer in intestines. Stool and anus, constipation, stool hard, dry, with wind and colic. Pressure and constriction in rectum with itching. Urinary organs, diminished quantity of urine. Urinate very often, especially during changes of weather. Specific gravity of urine increases from 1016 to 1023 with an excess of urates and ropey mucus. Male sexual organs, pains in testicles and cord of left side. Female sexual organs, severe pains in breast in evening at beginning of menstruation. Menstruation with pains in lumbosacral and ovarian region less than when walking. Blood lumpy, lasting more days than usual. Menstruation, returns 14 days after parturition. Sensation of heat in genitalia externa, with increased leucorrhea. Respiratory organs, enlarged tonsils, hard, dry, hacking cough during sleep, expectoration thick, easy, profuse bronchorrhea, cough and expectoration lasting 4 months, from a wetting shortness of breath, sensation of suffocation rolls all over chest even with plenty of fresh air, lungs for cold air, bronchopneumonia in children, deposits begin in apex of lung. Compare antimonium tartaricum, rattling of the mucus in the chest with little expectoration. There is much congestion in the chest but the expectoration cannot be raised. A cough usually ends up in vomiting. Natrum sulphuricum, ill effects of damp, rainy weather, from the night air, cold food and drinks, vegetables, fruits, in cellars cough with thick, ropey, greenish expectoration, chest feels all gone. Better in warm, dry air. Thirst for something cold and desires ice or extremely cold water. Adenoids. Adenoids hypertrophy with great sensitivity to cold and low temperatures. Calcarea carbonicum. Adenoids enlargement with excessive sweating of the head. The child is very sensitive to cold air and takes cold easily at every change of weather. Burrito carb. Adenoids with tonsil enlargement. The child has catarrh of posterior nares. There may even be pus formation in the tonsils. Thuja. Adenoids enlargement with greenish discharge. There may be a feeling of painful pressure at the root of the nose. Sanguinaria nitric acid. adenoids with sense of obstruction. Heart palpitation early in morning with cough and sticking pains in lungs less than when raising himself up. Death from paralysis of heart. Neck and back, tension in nape of neck and down spine, chilliness between shoulders or up the back limbs, sensation of formication in arms and legs, great weakness in limbs after dinner with fatigue and faintness in all limbs, trembling and twitching in the limbs. Skin, erythematous eruption with subcutaneous indurated nodules, itching all over the body in the evening in bed, changing place after rubbing, rash on abdomen and back, commencing very red, speedily becoming brownish, resembling ordinary skin eruption of secondary syphilis, fever, post-critical temperature of a remittent type shivering, when beginning to sleep, cold feet in bed. Modalities: worse motion, music, before a storm, standing, dampness, from draught, early morning, and after sleep, better open air. Remedy relationship compare. Hydrastis, to fatten patients after tuberculinum, formic acid, tuberculosis, chronic nephritis, malignant tumors, pulmonary tuberculosis, not in third stage, however, lupus, carcinoma of breast and stomach. Dr. Krull uses injections of solutions corresponding to the third centimole potency. These must not be repeated before 6 months. According to Burnett, varchinosis may block the way of action of tuberculin until thuja. When tuberculinum fails, syphilinum often follows, advantageously producing a reaction. 13. Complementary, calcarea, China, Bryonia. Dose: tuberculin needs more frequent repetition in children's complaints than nearly every other chronic remedy, 30th and much higher, in infrequent doses. The first dose of tuberculinum in any difficult case is, however, the weightiest prescription. The remedy should not be given without a most careful cardiac examination. As the surgeon before the anesthetic, so must the physician know the heart before administering this drug, especially to children, and seniles and to young seniles. The above caution applies also to asthma, pleuritis, peritonitis in scrofulous, tuberculous subjects. Tuberculinum bovinum Kent right pointing arrow calcarea carbonica right pointing arrow silicea terra right pointing arrow saurinum. Mental clinicals 1. Hyperactive restlessness, ADHD, and autism. 2. Temper tantrums. 3. Depression. 4. Changeable and destructive mentality. 5. Anger episodes. 6. Obsessive-compulsive disorder, OCD. Physical clinicals 1. Chronic recurrent tonsillitis. 2. Chronic asthma. 3. Chronic renal conditions. 4. Recurrent chest infections. 5. Recurrent skin conditions including recurrent pimples. 6. Chronic enuresis including worm infestations. 7. Chronic gastritis. Thank you.